Next up, I'm going to go through how to work on a scapula. And you got to work on the entirety of the scapula. You see this young lady here has a pillow right there. That serves a couple purposes. One is it gives her something to rest her arm on. Certainly that's good positioning for sleeping. Some of our patients actually are already doing that. Next thing I'm going to do is ask her to come a little closer towards the ledge so that I don't have to reach as far. And now you see the pillow actually helps for me because it keeps us a little block between the two. Now what I like to do with the scapula is get my fingers right along that scapula and work my way up. Pretty much everybody's tightened that upper trap. But I'm using my middle finger working its way through. Did you ask which finger I'm using? Yes, this one. No, this one, excuse me.
Oh my gosh.
And when you find that trigger point that you're running your finger along, that's where you work. Now, the other hand can apply a little bit of a force to distract it, right? So the two hands are working together to try to loosen it up. And you take a bigger sweep through the middle of the scapula. And at a certain point, you need to start working down the inferior angle of the scapula. So commonly trigger points here, so commonly. I know a lot of people like to get their fingers in under and lift people up by that, but I don't think that's the right way to go. I think you need to do more rhythmic rocking. So in addition to this hand doing the technique, this top hand is applying that little rotational force. And when you get to the inferior angle, you can't forget to work your way back up. Because that subscapularis muscle, that's on the way up towards the armpit. The lateral border of the scapula, that one right there is so commonly tender. So commonly tender. It's a good spot to be working on. I don't know why this one would have that spot, because the tight subscapularis is often associated with frozen shoulder. I don't know why this one will be so tight. I don't know. But I've been working my way up with my thumbs, and I get the whole thing, and I'm working the scapula all the way around, trying to loosen it up. Nice technique there. Now, in the handout you see there's the thoracic rotation stretch. That's when you're working along the medial border, and you're adding your thoracic rotation. You could actually have your patient do that actively. Go ahead and twist, so that you're just working together to get a good stretch in. And then once they're ready for it, you can line them up and do a good little stretch like that. Get in a little manip too, as you're working your way up to it. So thank you.